Ignaz Philipp Semmelweis, 1818 to 1865, was a Hungarian physician and is famously known as the savior of mothers and the pioneer of antiseptic procedures, the father of hand hygiene. His primary life-saving contribution came from identifying the cause of puerperal fever, or childbed fever, a devastating infection that killed vast numbers of new mothers in European maternity wards in the mid-19th century. Here are the key points of his discovery. The Great Discovery, 1847. The problem. Working at the Vienna General Hospital, Semmelweis observed that the maternal mortality rate in the clinic, staffed by doctors and medical students who regularly performed autopsies, was dramatically higher, sometimes 10% to 18%, than the nearby clinic staffed solely by midwives, rate around 2%. The hypothesis. He concluded that the medical staff were carrying what he called cadaverous particles, now known as bacteria or germs, from the autopsy room to the delivery room on their unwashed hands. The intervention. He mandated that all doctors and students wash their hands and instruments with a chlorinated lime solution, a strong disinfectant, before examining patients. The dramatic result. The effect was immediate and undeniable. The maternal mortality rate in his clinic dropped to below 2% within months, achieving a rate comparable to the midwife ward. A tragedy. Despite the clear statistical evidence, Semmelweis's findings were largely rejected by the medical community of his time. His theory contradicted the established miasma theory of disease and was seen as insulting, as it implied doctors were responsible for the deaths. He was ostracized, struggled with mental health issues, and his ideas were only fully accepted decades later, after Louis Pasteur developed the germ theory of disease, which provided the scientific explanation for Semmelweis's practical observations.